Hello and greetings everyone. Welcome to yet another insightful USTM podcast. I am your host, Miss Kilang Jamir, Assistant Nursing Superintendent of P.A. Sangma International Medical College and Hospital, Meghalaya. With the change in weather, we have a lot of complaints from different households relating to common cold, fever, dry skin, etc. To tackle all of the questions, we have with us Dr. Rachna Das Hazarika, Medical Superintendent, P.A. Sangma International Medical College and Hospital, Meghalaya. We welcome you to the show, ma'am.
Thank you very much. It's a pleasure to be here.
Ma'am, what are the common diseases seen these days in the winter season?
In winter season, usually we have diseases like common cold, fever. A lot of viral fevers are occurring. Then some patients get coughs which last for a longer time, like asthma. Then you have diarrhea, and many children also get, and adults also, they get skin diseases because the skin becomes very dry in winters, and many people don't know how to take care of their skin. So these are some of the common things that we see, and in some cases, especially in the very young and the elderly, then they are also susceptible to get pneumonias. So these are quite common in the winter season.
Okay, ma'am. Ma'am, since you mentioned that fever is really common, how would we know, how would a person detect fever?
So most of the time, the common person would say like they have fever by feeling either they're feeling hot or they're getting chills, or in case of children, they will feel the temperature, the parents, and then tell you that they are having fever. But many a times what happens in winters, because they overclothe their children, so sometimes even if they're not having fever, they feel warm. So in that case, what actually one needs to do is use a thermometer. So if they use a thermometer, then only they will know whether the patient has fever or not.
Okay.
So normally around, we know that in Fahrenheit, 98.4 degrees is normal temperature. But there is also one very interesting thing here, that temperature ranges different. Like in the morning it is different, in the evening it is different. So in the morning usually, or in the daytime, temperatures are usually around 98.4, 98.5, but it can rise up to 99 in the evening. So that is also a normal temperature. In our medical terminology, we call it the diurnal variation, the variation which occurs during day and night. So even up to 99 is normal. In the case of, if you're using the centigrade method of measuring, then up to 37.4 is a normal temperature.
Ma'am, another thing, where and how do we measure the temperature?
That's a very good question. Usually temperature can be measured in the oral cavity, in the mouth, or under the axilla, or in the rectum. But nowadays we're using only the axillary method of seeing the temperature because it's the safest, it is the easiest to do. So, but one mistake particular which everybody does, and I think even our nursing staff I see sometimes they do, is that when they apply the thermometer, it is not actually inside the axilla, it goes outside. So even if the patient has fever, then you're actually not measuring the right temperature. So you're measuring the air temperature. So if I can use this pen just to show that, suppose this is a thermometer and we want the patient's temperature to be measured in below the arm. So usually our tendency is that, the tip of the thermometer, we place it like this. So it then goes out, it measures the temperature from outside. But the ideal way to put it is like this, in line with the body, and then you have your hand down. And nowadays we are all using digital thermometer. So you wait till the thermometer gives you the indication. You'll hear a sound. I'm sure we hear it in the digital thermometer. So it takes about 2 to 3 minutes to actually get the perfect body temperature. So after that you take it out and you read, because now it's digital, so you can read it in the thermometer itself, what is your temperature. So that is how it should be measured. But most of us, would do this, which is a wrong method. And then we also have these digital thermometers, but there are pluses and minuses of digital thermometers, because if you hold it too far or too near, then the temperature changes. So the best is the one, not those air gun type of, we should not use those. We should use the one which is the digital one, which can be directly touched to the body. Okay, but in our clinic we also use something in the ear which is more accurate.
Yes.
So that we would not advise parents to do it. So for them the digital thermometer is the best.
And ma'am, do all the fevers need treatment?
No, that's a very good question. So if you have fever which is only above 101 degrees Fahrenheit or more than 38 degrees centigrade, that is the fever which actually requires treatment. And there are some people who are comfortable even at 101. So if they are comfortable, we really don't treat it. But if there is a discomfort, say the child is becoming very cranky, doesn't want to, eat food, cries all the time, or in an adult he feels very uncomfortable, extremely hot, then we will use drugs to reduce the temperature. Otherwise, if they are comfortable, then we let the fever be there.
You have made it very easy, ma'am, for all of us to distinguish between the different types of fevers. And ma'am, another question, when should one be worried about high-grade fever?
Okay. So usually, again, another very good question, because most of the time people will ring us up and tell, my child is having or I'm having very high grade fever, and then we measure, when we measure we see it's only 101 or 102. So up to 104 is acceptable, but any temperature which is above 104 degrees Fahrenheit or above 40 degrees centigrade, that is the temperature that we should worry about, because in those temperatures what happens that they may have some other problems along with the fever. For example, in very small children, those below 5 years, they can throw a seizure, okay, or they may have a lot of chills, they may have a lot of problems in eating or drinking, and sometimes at very high temperature they start talking irrelevantly. So sometimes they come and tell us that my child is having fever and we don't know he's talking all nonsense. So in those kind of fevers which are very high grade, then we should be worried, because it means that there is something else happening. Then there is another thing, that suppose patient has high grade fever, but in between the fever patient is fine. Then also we don't have to worry much. You may have a fever of 103, 104, but after you've given the treatment and the child especially becomes playful, then it means it's not a serious illness. So that is the reason we like to measure the temperature, actually measure it, and then see what is the temperature in the numbers.
Okay, ma'am. Ma'am, there is this trend going on people using a lot of over-the-counter medications. So ma'am, during fever, what would be the safest medication to use?
Another very good question. See, in fever, the safest medicine to use is paracetamol. There are many combinations available in the market, like ibuprofen with paracetamol, mefenamic acid with paracetamol, but these are not safe combinations. And many years back, the nimesulide was very easily available. That is actually now banned, so because it has other side effects. So if you ask me what is the safest is paracetamol. But the problem is that sometimes when you use paracetamol, say suppose a patient has a fever of 104, and especially in viral fevers, you give the paracetamol and then the temperature only drops up to say 102 or 101. Then parents, especially in case of children, parents become very, very anxious, and then they want to use something else additional, and they'll end up taking the temperature down to subnormal level. That means even below 98. So finally the temperature becomes, the child becomes more cold. So that is not good. A little bit of fever is actually good for the body.
And that's a very interesting thing. Why would you say that fever is good for the body? Could you explain a little bit?
Yeah, I'll be more than happy to. This is one of my favorite questions to answer. Why we say fever is good for the body is that it means that your immune system, your defense mechanism of the body is functioning well. So what happens? Why do we get fever? Either you have to have a bacteria or a virus entering your body, and all the bacteria, viruses, parasites, whatever they enter are foreign bodies. So immediately when they enter, the body recognizes that this is a foreign body, and it, in response to that foreign invasion, it raises the body temperature. It is seen that many of these organisms or microbes at a particular temperature, their multiplication in the body is stopped. So if you allow the fever to continue at a comfortable level, then the multiplication of these bacteria or virus, especially the viruses and parasites, will stop, and they will not, the disease will get cured more early. But suppose you over-treat the fever, like I said, suppose you make the fever too much below the normal range, then the bacteria will keep on multiplying, the virus will keep on multiplying. So the patient who was supposed to get well from a viral infection, say in 2 or 3 days, will have it for a more prolonged period of time. So actually it shows that it's a good immunity, and it also indicates, because otherwise suppose you got an infection and you did not mount a fever response, then you'd sit at home, and finally when you get into a septicemia or a shock or you become very sick, then only you'll be recognized. So fever also helps us to recognize that some problem is going on in the body and it needs treatment or maybe investigations.
So ma'am, when should one investigate in case of fever?
In case of fever, see, we do not need to investigate any fever on the first or the second or the third day, okay, unless the patient is having some other problem. For example, if it's a cancer patient on chemotherapy, or somebody is getting some drug which reduces the immunity, then even day 1 fever we are going to investigate. But if it is a normal person or a normal child going to school and has fever, then the most common cause is viral. So it's mostly the viruses. So in a viral fever, you don't need to investigate on the first day or the second day. You reassure the parents. If the fever keeps on persisting for more than 3 or 4 days, then you ask them to bring back the child, or the patient should come back. Then we will again re-examine, and if we find something abnormal, then only we'll investigate. But there are some fevers, like I said, when, like malaria or typhoid, which we can know from after talking to the patient or taking what we call a medical history. So in those kind of things, or now we have even in Meghalaya or Assam, we have a lot of dengue cases. So if we are suspecting and many cases of dengue are appearing, then in those kind of cases where we are sure that, okay, it could turn out to be this, then we will investigate. So unnecessarily parents should not rush, or patients should not rush and give blood samples and do all the tests on the first day. The second thing is, if you are having a fever with, say, very high grade fever with some urinary symptoms, there's a lot of burning, pain while passing urine, or there is a lot of cough, then we have to suspect that there could be a pneumonia or a UTI, urinary tract infection, and in those specific cases only we will investigate maybe on day 1 or day 2. But otherwise, I think we should hold on and see how the fever proceeds, how the patient behaves.
And ma'am, there is another very common problem, especially during winters, that is common cold. So ma'am, what are some of the causes, or what could be the factors related to cold and cough during winter?
Yeah, during winter it's already started.
Yes.
I think if you have 10 people around you, 5 of them are sneezing with nose block already now in the month of November. So the most common cause is a change of temperature. So many people are very responsive or hyper responsive to the change of temperature, because suddenly the temperature drops, becomes cold, so they get a reaction which is known as an allergic rhinitis, and they get a nose block and running nose. But more common than that is the viral infections. So because now the weather is very conducive for viral infections, so mostly they will have the flu viruses or the rhinovirus and something known as a respiratory syncytial virus, which will infect the individual, and this spreads very fast. So particularly in, say, you're traveling in a bus with an AC on, or on an airplane where everything is closed and the AC is running, or you're working in an environment where there are a lot of people working together, and especially in schools and play schools where they have a lot of children in one room. So if one gets rhinovirus infection, it will spread rapidly to the other people. So same with flu. So these are the most common causes. And another important cause nowadays is the pollution. So sometimes even a reaction to pollution, you will get a lot of sneezing and running nose. So we will know from the history actually when we take. So usually viruses which cause nose block and common cold will have a little bit of fever associated with it, whereas the allergic ones or the ones related to pollution will not have fever.
Any home remedies, ma'am, for cold and cough?
Yeah, usually cold and cough, they don't need much of treatment. You need to open your nose block. because that disturbs your sleep. So you can use the salt water saline drops which are available in the market. They're very useful. Otherwise, you can take steam inhalation, and even using a little bit of warm water with honey. But children should be above 1 year of age for that. When adults, there's no problem. So a little bit of warm water with honey and all can relieve the common cold. There are other things like tulsi and honey mixed together. They also work quite well. So I think these are the home remedies usually we will suggest. Okay. Even a hot cup of tea for an adult with some ginger and honey is a very good remedy for common cold.
And ma'am, is it important or is it necessary to have an antibiotic treatment for every cold and cough?
I'm so happy you've asked me this, because this is one of the biggest problems we have these days, the overuse of antibiotics. See, this common colds or any kind of flu is a viral infection. So antibiotic works only against bacteria. So if you use an antibiotic for a viral infection, it is a total waste of money, number one. Number two, it is going to cause more harm in the body because you're using something which is absolutely not required. And thirdly, we have seen, because of the misuse of antibiotics, especially I will mention one drug that is known as azithromycin, it has led to the appearance of antimicrobial resistance, which means all these other bacteria which are there in the environment are becoming resistant to that particular drug. So actually, if you get a bacterial infection, this medicine will not work. So it's an absolute no in case of viral infections or common colds, flu. There's no role of using any antibiotic at all. And people should avoid, going to the pharmacy and asking for such things over the counter. They should be very, very careful.
Ma'am, you had mentioned regarding asthma as well. So, ma'am, what are some of the causes, or how would you recognize asthma cases?
Yeah, very good question, considering that the number of cases are increasing in this season. So usually, asthmatics, they may have a family history. So if they have a family history and then we have somebody who is already a known asthmatic, then during this season, what happens because of the cold, the viruses, as well as the increase in pollution, they start getting coughs which don't get well too soon. A cough which lasts for a very long time, number one. Number two is if they are coughing and they are also hearing some funny noises coming from the chest, or musical sounds or wheezing sound. So those patients, we have to understand that it's probably something happening in the chest, and most likely it's an asthmatic attack. And these are the patients who actually should not self-medicate. They should come to the doctor, get themselves examined, because the treatment is absolutely different for asthmatic patients.
Ma'am, could you highlight more on the treatment part for the asthmatic
So
patients?
Treatment these days, we are using inhalers. So they are the little pumps with the medicine. In previous times, we were mostly using syrups and tablets, but they are seen that because this is a lung problem, and inhalers are better because the dose of the medication is very small compared to what you use in tablets and syrup. So if in a tablet it's in say 1 milligram, in an inhaler it will be only 100 microgram, which means it is 1,000 times less than a milligram, So this is one, the dose is less. Secondly, when you're using an inhaler, you're directly taking it into the lung. So the side effect in other organs will not occur. Otherwise, if you take a tablet or a syrup, what happens? You take it, it goes to the stomach, to the intestine, gets absorbed by the blood, and the blood will circulate everywhere. So it goes to places where it should act and also to places where it should not act. So the side effects occur. So therefore nowadays we are using mostly the inhalers. There are 2-3 different type of inhalers depending on what the age group, the kind of person. Say an older patient or an elderly patient, they'll have a different kind of inhaler, and in children you have different kind. So in adults you have. So there are a lot of choices, very safe choices, and I think this is the treatment that patients should take. And why I'm highlighting is the fact that if you say inhaler, the usual tendency is that the patients and the parents, especially in children, they become very edgy. They don't want to use it because they, in Hindi they will ask, "Aadat to nahi ban jayega." But actually it's nothing like that. It's only a different way of delivering a drug and a more safer way of delivering a drug. So you give the drug, it acts immediately in the lungs, relieves the patient, and it doesn't cause side effects. So that is why inhalers are the treatment of choice for any kind of asthmatic attack, whether be it child, adult, or even the elderly.
And ma'am, are there any risk if the asthma is not treated well, or if the asthma is not treated at all?
Yes, another very good question. I'm very glad you asked me this, because once you talk about inhalers, some people will really accept it well and they will follow your prescription. But there are other people who will use it maybe for the time, and as soon as they get well, they will stop it, or maybe not use it at all. And for various reasons, they may not believe you, or they may have the stigma that you get used to it. But the problem with asthmatics is that if you do not treat them correctly and you do not give proper treatment for a long duration, then the second attack of asthma or the third attack can be so severe that they may land up with not able to breathe, the oxygen levels may go down, and in my practice I have seen at least 2 or 3 children dying because of this not getting the treatment at the proper time. So this is a disease which is preventable, and people should understand that if you control the symptoms, a person can live a very normal life like any other person, so who doesn't have asthma. So the continuation of the treatment is important. So we have 2 kinds of treatments here. One is a preventer. So the preventer inhaler actually you have to take daily so that you don't get a severe attack. And if you get, in spite of taking a preventer inhaler, if you get an attack, then you have something known as a reliever. So the reliever you're supposed to use only when SOS, means whenever you have a chest problem. But if you are using the preventer inhaler regularly as per the doctor's prescription, most of the people will be absolutely like normal individuals. You cannot make out. I mean, can you make out that I'm an asthmatic? You can't. So because I take preventive medicine, I take the preventive inhaler. So that's what I tell my patients also when they are skeptical about that inhaler partner.
Ma'am, as discussed earlier, when we were discussing relating to the common diseases or common problems during winter, many would want to know about how do we prevent or how do we take care of our skin during winter, because it tends to go a little dry. So what are some of the steps that we need to take, ma'am?
Yeah, I think this will be a favorite question for the audience, because skin is the largest organ in the body, and we actually ignore taking care of our skin, but we really need to take care of this biggest organ in our body. And the reason is that because if you have a dry skin or cracked skin, which usually occurs in winters, then we do not see the cracks actually. But if you put a microscope on the skin, then you will be able to see there are a lot of cracks. And through these cracks, the allergens which are there in the environment, the pollen, the other, sulfur dioxide or carbon monoxide or those carbon particles, without our knowledge, they will enter and they will cause a lot of allergies. So they can start it off as a skin allergy, where you get rash and dryness, more dryness, or it could lead to a nasal allergy, which we talked of in the beginning, the allergic rhinitis, or even severe cases, it can lead to asthma also. So it can trigger an asthma. So that's the reason it is very important for all people to take care of the skin. And the best way is to moisturize the skin, which we can use normal coconut oil. Virgin coconut oil is available, which is very good. It is very good for the skin, so you can use that. Many people ask me, what about mustard oil? But I usually would not like to advise mustard oil, because sometimes it causes some severe reactions because of impurities which are there in the mustard oil. So safest is coconut oil. And coconut oil also is good in the sense that it has the medium chain triglycerides, which itself is a good nutrition for the body. Then the second is, when you're having a bath, the water should not be too hot, because usually in winters everybody likes to have bath with hot water. So you take just lukewarm or warm enough so that you don't feel cold, because the more hot water you use, the more it dries the skin, because our skin also has natural oils. So if you use too much of hot water, then what will happen? The natural oil layer will go off. Thirdly, the soap, or whether it's the bar soap or the liquid soap, that should be gentle. And you should not use too much of soap. You just need a little bit of soap, to just form a small mild lathering effect. And because if you use too much of soap also, it is going to wash off the natural oils. Okay, and then after you finish a bath, if you're very dry skin, you can apply. There are lots of emollients and lotions available of various companies. All of them are good, but if you are having very dry skin, it is always good to speak to a medicine person or a pediatrician or a dermatologist and get the proper skin lotions and creams prescribed. So if you take this much care, then you are going to have very good skin. Like for example, you are shining, your skin is shining. And one more thing is there, in winters we'll end up wearing woolen clothes. So if you wear woolen clothes directly, then sometimes it causes a lot of dryness and itchiness. So if you're allergic, already you have a dry skin, it is better to avoid woolen garments and to use thick cotton or even the cotton jackets. They're much better. And in small babies, we always advise them to use the flannel cloth, which is warm as well as non-allergenic.
Thank you, ma'am. That was very informative, especially for the girls and the boys.
And the boys too.
Everyone is really skin conscious these days. Ma'am, with the change in the weather again, we see a lot of cases of loose motion or even vomiting in case of children. A lot of cases come. So any way to tackle, any way to treat those kind of cases at home?
Vomiting and loose motions are again because of viral infections in winters. Some of the viruses which cause the common cold also can cause diarrhea. But there is one particular winter virus which is known as rotavirus, which used to cause a lot of diarrhea in the past. But in the last 5-6 years, everybody universally is getting the rotavirus vaccine when they are in the early infancy. So because of the use of the rotavirus vaccine, this rotavirus diarrhea has come down to a great extent. So now whatever diarrheas we're getting, mostly they're non-rotavirus ones. And the best way to treat is, like make sure that the fluid intake is good. We have to use WHO ORS. And if the vomiting is too bad and doesn't stop, then it is better to visit a physician or a pediatrician and get the medicine prescribed. Never self-medicate. Many a times, again, I will talk of antibiotics here. As soon as the patient has diarrhea, there is a tendency to go and get antibiotic combinations for diarrhea over the counter. Now, again, here I'd like to emphasize that if it's a viral diarrhea, it's a totally useless drug to be taken. In fact, it will cause more harm. Because all of us, I don't know if you're aware, they have good bacteria in the intestine. So we call the gut microbiota. And once you use an antibiotic, we destroy the entire good bacteria. And this destruction of good bacteria leads to other health problems like obesity, hypertension, diabetes. So I think we should be very careful in not trying to destroy the God-given or the nature-given gut microbiota or the organic good bacteria that we have in our body. And then there are home remedies, like you can ask the patient to have a lot of bananas, curd or homemade dahi, which is there, khichdi. Even in Assam, we have a tradition of having the raw banana, the green banana, so they can be boiled and taken, mashed and taken. This is a very good way to stop diarrhea because the fiber in the banana absorbs the water from the intestine and solidifies the stool. So this is, if you give this diet, then very soon from liquid it will change to semi-solid and solid stool. So that's a very natural way of treating. Plus there are many herbs which are there. So traditional herbs are there. So they can use that also. But I think WHO ORS is number one. And if it doesn't stop, then visit a doctor and get a prescription for it.
Thank you so much, ma'am, for clearing all the doubts relating to the winter complaints that all the people have. And I'm sure that it will be beneficial for all our viewers. Thank you, ma'am.
Yeah, thank you very much. It was a pleasure to be on the show. Thank you.
Thank you so much for tuning in to our USTM Voice podcast. If you like this video, please don't forget to like, share, and subscribe to USTM Voice. Thank you.